This conference will now be recorded. This conference will now be recorded.
Today's webinar on Aedes
This conference will now be recorded.
Hi everyone, I Devashree from the SciBug team welcome you all for today's webinar. Today's webinar on Aedes, breakbone fever is brought to you by the team SciBug. Speakers of today's webinar are Dr. N. Ashok Vishwanath and Dr. S. Fayaz Pasha. Our today's speakers will be imparting advanced knowledge on the most common infection caused by the vector Aedes aegypti, also known as breakbone fever. At this juncture, I would like to thank our eminent speakers for taking time out of their busy schedule to join us through this webinar. It's highly honorable for our team in hosting this webinar. SciBug has successfully completed 6 webinar talks so far and steps into organizing the 7th webinar talk today. Now, I would like to introduce you all to our guest speakers. Dr. Ashok has a degree in MBBS, MD, DNB, MNAMS, and has a PG diploma in infectious diseases. He is currently working as assistant professor in clinical microbiology department and is a consultant clinical microbiologist. Dr. Ashok has achieved distinction in MD degree exam, All India First in DNB degree June 2020 session with a specialty of microbiology and is also awarded President National Board of Examinations Gold Medal at New Delhi. Dr. Fayaz is the director of Care and Cure Clinic, Madurai. He has obtained his Bachelor of Medicine and Bachelor of Surgery from Annamalai University. He has also obtained MD degree in microbiology from Vellamma Medical College, Hospital and Research Institute affiliated to prestigious the Tamil Nadu Dr. MGR Medical University. As of now, he is a busy clinician with special interest in the field of infectious diseases. Alright, before starting the session, a humble request to all the participants. If you have any questions, please write in the chat box. All the questions will be addressed after the session is over. Also, please make sure to keep your audio and video settings off in order to avoid disturbances during the session. Now, I would request our speakers to take over. Thank you.
Hi everyone. So good evening everyone. So like I hope you all enjoying your evening, and it's going to be a cool evening, and tomorrow's Diwali. So I won't take much time. Like today's topic is about breakbone fever. So before going into the topic, I wanted to thank the SciBug team and also want to thank the busy clinician Dr. Fayaz. So with this, let me go into the topic today. So were you all able to see my screen clearly?
Yes, sir.
Yes, sir.
Okay, so thank you for your response. So today, we are going to have a two session. So I will be talking about the basic definition, then the epidemiological part, and I will be talking about the pathogenesis of this particular infectious diseases. So following me, we will have a break of 1 or 2 minutes. After that, Dr. Fayaz will take over the session, and he will be talking about the various clinical aspect of this particular infection, and he will talk about the various lab diagnostic tests which is available and which is done to diagnose the type of this particular infection, and also about the treatment part. So let me go into the topic now. So today's topic is going to be Aedes breakbone fever. So can anyone tell what is Aedes and what is a breakbone fever? So Aedes is
Aedes
actually
is a
going to be a
mosquito.
mosquito. So there is two type of mosquito called Aedes aegypti and Aedes albopictus. So this particular mosquito is going to cause an infection called breakbone fever. So breakbone fever is nothing but one of the arboviral infection. So can anyone tell what is a breakbone fever? Any idea what is a breakbone fever? So we
It's
have
example
various
of
types of
dengue.
fever. Very good. It's going to be dengue fever. So dengue fever is named as breakbone fever because there is going to be severe pain and the patient is going to present to us with the complaint such that the patient is going to have a broken bone. Okay, so that's why it's called as a break bone fever, and it's a type of biphasic fever, and it's going to be transmitted by this particular Aedes mosquito. And being an India and tropical climatic condition and warmer climate, this particular disease is going to be an endemic in our part of the world, and it's going to be like there is going to be a diversified origin of this particular infection, and there is going to be like five strain which is going to cause the infection. And when we are going to talk about this particular infection, like we have something called primary dengue and the secondary dengue. So when we are going to read about the infection for the first time, so when this particular virus is going to transmit the infection for the first time, so it's going to be the primary dengue. And again, like when we are going to get infected with some other serotype, it's going to be the secondary dengue. So with this, like we'll go, like we'll see what is a dengue fever. So it is going to be a mosquito-borne viral infection, also called as arboviral infection. So we call it as arboviral infection because it's going to be an arthropod-borne viral infection, and it's going to be transmitted by the Aedes mosquito. And there are like two types of Aedes mosquito which is going to transmit this particular infection. One is going to be the Aedes aegypti, and another is going to be the Aedes albopictus, and it's going to cause two type of dengue fever, which is called as primary dengue fever and secondary dengue fever, and it's going to be complicated by the hemorrhage and the shock. So this particular mosquito, what it's going to do is that it's going to suppress the platelet production from the bone marrow, and also going to destroy the peripheral platelet in the bloodstream. So what is going to happen is that there is going to be severe thrombocytopenia, or the platelet count is going to go down, and ultimately there is going to be hemorrhagic manifestation. And another thing is that it's going to cause vascular endothelial injury. So thereby there is going to be a plasma leakage from the blood vessel compartment, and the patient is going to go into the shock. When these two combine to form, like it's going to cause something called hemorrhagic shock syndrome. So now moving on to the epidemiology, like this particular infection is diversified all over the world, and there is going to be a color marking ranging from the yellow to the red. So our India and Southeast Asia, so these part of the country have been marked as a red area. So our India is going to be an endemic for this particular dengue infection, and our India is going to be an tropical climatic condition. It's going to be very common in our part of the world. And another thing is that our part of the world is going to be having a warmer climate. So wherever there is going to be a warmer and humid climate, there is going to be a better yield of this particular mosquito, and there is going to be better spread of this particular infection. So in our part of the world, the first rank will go to like it's going to be the Karnataka and Kerala, where there is going to be like a high number of cases. Though government is taking very good action to prevent this infection, like we are going to have high number of cases in our part of the world. And the second rank go to Maharashtra. So like there is going to be like a certain etiological way by which the particular infection is going to spread. So there is going to be a severe rain, and there is going to be the stagnation of this particular water, and there is going to be breeding by this particular mosquito, and there is going to be infection by this particular mosquito. So with this definition and epidemiology, like we are moving on to the pathogenesis. So like this pathogenesis will tell us about how this particular virus is going to cause an infection. So like whenever like we are going to get bit by this particular Aedes mosquito, like we are going to get inoculated by this particular virus. And once the virus goes inside our body, there is going to be the release of non-structural one protein. And following the release of non-structural protein, there is going to be the pathogenesis mechanism. What is going to happen is that this particular primary dengue, so it's going to suppress the bone marrow production of platelet. So and also it's going to destroy the platelet in the peripheral bloodstream. So this particular both this combination is going to lead to the peripheral destruction as well as the suppression of platelet production, going to lead to the thrombocytopenia. So thrombocytopenia, like it's going to be a reduced platelet in the peripheral blood. That's the thrombocytopenia. And whenever like we are going to have thrombocytopenia, it's going to lead to the various complications like a hemorrhage. The patient can present to us with the various bleeding manifestation, and it can be something like hemoptysis, which is blood in the sputum, or blood in the stool, which is called hematochezia. And we have something called hemoptysis, hematemesis. So the patient can present to us with multiple complaint. And when the patient is going to get infected for the first time, so it's going to be called as primary dengue fever. So during the time of primary dengue fever, there is like formation of two type of antibody. One is going to be the neutralizing antibody and non-neutralizing antibody. So the importance of this particular two type of antibody is very important pertaining to the secondary dengue. So again, like when we are going to get infected with the some other serotype of this particular virus for the second time, we are going to develop something called secondary dengue fever. So during the time of primary dengue fever, what's going to happen is that there is going to be production of two type of antibody. One is going to be the neutralizing antibody, and another thing is called as a non-neutralizing antibody. So again, like when we are going to get affected by some other serotype for the second time, what's going to happen is that the first serotype which has been formed during the primary infection will be acting as a protective antibody, whereas the second type which got formed during the particular type of infection, so this particular non-neutralizing antibody is going to cause vascular endothelial damage, and there is going to be like plasma leakage, and ultimately like it is going to lead to a shock syndrome. So ultimately the secondary dengue fever like have high chance of patients going into the hemorrhage and shock syndrome, and few patients can go into both hemorrhage and shock syndrome, which is called as hemorrhagic shock syndrome. So this is about the pathogenesis of this particular dengue fever. So I think like you got a good clinch about this particular definition, epidemiological part, and the pathogenesis mechanism of this particular dengue infection. And after this session, like we will be having a 1 minute break. After that, Dr. Fayaz Basha will take the clinical part, which is going to be a very important thing. So he'll cover about the clinical aspect and the serological diagnosis, and he will talk about the treatment and the preventive part. So this is going to be the end of first session. So do you guys have any doubt in this particular session?
Sir, is that true that a painkiller can uh, remove the dengue fever? Like, can treat
Actually,
the
like we
dengue
are
fever?
not supposed to. Yeah, like actually like Dr. Fayaz will talk in brief about that. Actually, like we are not supposed to give any painkiller for dengue infection. So most of the painkiller they
Okay.
are called as non-steroidal anti-inflammatory drug. So what it does is
Okay.
that there is going to be an action against the inflammatory cytokine, and NSAID has its own complication of forming an ulcer in the gastric mucosa, thereby like it can lead to increase in the hemorrhagic manifestation.
Okay, sir.
So shall we have an interval of 1 minute? Okay, so we will have an 1 minute interval. After that, Dr. Fayaz Basha will take over the session.
Good evening, everyone. Am I audible?
Yes, sir.
Yeah. Shall we start? Shall we start?
Yes, sir, please. Yes.
First of all, I would like to thank Dr. Ashok and SciBug team for giving me this opportunity. And now my part is to explain the clinical feature, serology, lab diagnosis, treatment, and prevention. So, first of all, the patient, first and foremost symptom the patient will come to our clinic will be the fever. Uh, and these are the non-specific symptoms the patient will be having. Like the patient will be coming with fever, headache, vomiting, muscle pain, retroorbital pain, rash, etc. The most common symptom the patient will be presenting with the dengue viral infection will be the joint pain. The patient will come to our clinic and they will say, "Sir, from the first day itself, I'm having the unbearable joint pain which I have not experienced before." The patient will be having the uh, bilateral joint involvement. They will be having severe joint pain. This is the main symptom the patient will be presenting with the dengue viral infection. The second most complicated symptom the patient will be having will be the bleeding part. That the Dr. Ashok have explained, the bleeding is due to the peripheral platelet destruction and bone marrow suppression. So science is a thing what we look for, like what we will be looking for, like we'll be taking seriously clinical history. The patient will be having fever, joint pain, rashes, and the rash will be morbilliform rash will be there. The mainly seasons the doctor also have told, like in India warmer climates is also an important factor. It will be the season. In arthralgia, I have told that there will be a bilateral joint pain, the fever, mainly biphasic fever. That means the patient with dengue viral infection will be coming with like, sir, I'm having a fever for 2 days, and the next 2 days I'm not having any fever. I'm all right, sir, and again I'll be having fever. Like that patient will be coming to our clinic. This is known as biphasic fever. This is a typical uh, symptom the patient will be telling to us. The rash will be like a morbilliform rash, that in chickenpox infection there will be vesicular rash. For dengue viral infection there will be morbilliform rash. And the next one is a tourniquet test. It is a simple test what we are doing in our clinic to find out whether the patient is having dengue viral infection or not. We will be doing simple BB monitoring, like systolic and diastolic BB monitoring. In between systole and diastole, we will stop at a point and we'll be looking for an petechial spots will be there, and more than 10 petechial spots denotes the tourniquet test is positive, which is in the more favor of dengue viral infection. The bleeding is the main complication I have told, that is due to the plasma, peripheral platelet destruction and the bone marrow suppression, and leads to the reduced platelet production. So, what is the warning sign? The warning sign is the main thing. We have to admit the patient in the ICU, and we will be seriously monitoring. If most of the times the dengue viral infection will be asymptomatic, or else most of the time they will be all right, like they will be having fever, and they will be easily they will be cured. But the main thing what the clinician should keep in our mind, the patient will be coming with warning signs such as abdominal pain, persistent vomiting, clinical fluid accumulation in the heart such as pericarditis, or in the abdomen such as ascites, or the patient is coming to our clinic with a mucosal bleeding. It's a very important thing. And lethargy, restlessness, and the liver enlargement due to the reticuloendothelial system involvement. These are the warning signs we have to keep in our mind. uh, Rest of the things that most of the time it is like the dengue viral infection will be I'll be seeing in the clinic for throughout the year, not only during the winter season. In areas like India, we'll be seeing the patient throughout the year. But most of the time the dengue viral infection is not much severe, but only during those times the patient will be having with severe clinical manifestation. They will be having a severe bleeding, and at times will lose the patient. So I'll be saying about serology. So how we are diagnosing. On the first time, if the patient is coming to our clinic, the very first day the patient is complaining that, sir, I'm having a severe joint pain, sir, I'm having fever. On the very first day itself, the dengue NS1 antigen, that is non-structural 1 antigen, will be positive. Like if we check dengue NS1 antigen the very first day, if it is come as, we can easily diagnose it is a dengue infection. It is a primary dengue infection. So Dr. Ashok have clearly told there are two type of dengue infection, like primary dengue infection and secondary dengue infection. And dengue IG on the from the third day to fifth day, uh, immunoglobulin M, dengue immunoglobulin M antibody will come into the picture, and will be checking it. It may also due to the acute infection. In the acute infection, IgM antibody will come into the picture from the third day to fifth day. So, and after like seventh to 12th day, our body will produce IgG antibodies, which will be there for lifelong. If a particular dengue serotype is we are if we get infected with a particular single serotype, once the immunoglobulin G, that is the antibody, if it is produced, it will be staying lifelong. The thing is, it will be protective against that particular serotype only. Actually, we have like 4+1 serotype. Mainly if there's a thing such as secondary dengue, if the patient is coming with another serotype, it will create a complication, like it will produce antibodies. The two types of antibodies that are told that dengue viral infection will produce. The first one is neutralizing antibody, and the second one is non-neutralizing antibodies. If the patient is having the second type, patient is having dengue viral infection with another serotype, thus non-neutralizing antibody will activate the antibody dependent cellular cytotoxicity, and that will lead to the endothelial damage and plasma leakage and the shock syndrome. So that is the most common complication that will severe complication, and it may leads to death. So, and the lab diagnosis, I have told that dengue NS1, IgM, sorry, IgG, uh, CBC. We are looking the first thing what we are looking in our clinic is complete blood count, and these are the non-specific lab diagnosis such as CRP, LFT, RFT, serum electrolytes. What we are looking for, and in the lab diagnosis part, the most sensitive test is going to the enzyme immunoassay. Both enzyme-linked immunoassays are CLIA, Chemia, and so on. And these rapid cards are I have only to show you for demo purpose, because dengue test should be carried out by enzyme immunoassays like ELISA, but not with the this is the immunochromatographic card. What's the point of care test? What we can do in our clinic. This is the first one is the before sample testing. It shows no bands, like the control area is there and test area is there, and it shows no band in that. So the next one is, first one is NS1 antigen, and second one is for IgG and IgM. What we are checking, NS1 antigen, IgM antibody, IgG antibody. Then after sample addition, what we are looking for, there will be a control band will be positive, must be positive. Therefore only the card is valid. So now I will be explaining how we come to know, we will be knowing about which is primary infection, which is secondary infection, and when we should be very careful like that. Because in primary infection, most of the time patient will be all right. The only thing, mainly we will be very serious in our mind to find out whether the patient is having the primary or a secondary infection. And how we will diagnose, like you see in this card, and then after sample addition for dengue NS1 antigen, the control band is positive and the test band is positive. So it denotes that dengue NS1 antigen is positive for that sample. And the next IgG and IgM, the control is positive, and IgM IgG is negative. It shows primary dengue infection. That is the first time that is the patient is having infection, dengue viral infection within like 1 or 2 days, or the first 0 day itself. So this is a primary dengue infection. Then here you see, like in a dengue NS1 antigen card, that after sample addition, dengue NS1 test is positive, control band is positive, test band is positive. So dengue NS1 positive, and after that IgM is positive. It denotes acute infection. So it is also a primary dengue viral infection. So you see here dengue NS1 antigen test is positive and IgM IgG is positive. So the patient is having secondary dengue infection, because in primary infection there should be an NS1 antigen or IgM and IgM antibody will be positive. If it is in secondary infection, IgG will be positive. So it is an secondary dengue infection. So here you see dengue NS1 antigen is positive, and only IgG antibody is positive, and IgM is negative. What it is, can anyone tell? So it is due to the past infection. The patient is having the IgG antibody, which is produced due to the primary dengue viral infection before the past infection, which will be positive lifelong. So mainly complete blood count is the first test what the clinician will do in the clinic. So mainly what we are looking for is the packed cell volume, that is hematocrit and platelet count. So mainly the packed cell volume will be higher or lower, depending upon the, if it is increased or decreased, we will be descending the treatment options, whether we have to use the IV fluids, crystalloids, or else we have to do transfusion, fresh frozen plasma transfusion or not. And the second thing is platelet count. The platelet, it is a thing which is present in the blood, in the blood vessels for aggregation. Like if it is an any bleeding, and the platelet will goes to the area and it will aggregate and bleeding will stops. That is the main thing. What Why we are not having bleeding manifestation? If the platelet is low, the what the patient will having is there will be a prolonged bleeding because there is no aggregation, and our blood will not clot, so there will be continuous bleeding will be there. So it is a very alarming symptoms that if it is an severe bleeding, there should be a severe blood loss, and it will leads to shock syndrome and eventually leads to death. So this is about lab diagnosis. Now treatment options. Mainly the most of the viral infection are asymptomatic, or else we will be doing mainly symptomatic managements. So antibiotics should be given only for the bacterial infection, not for the viral infection. For the viral infection, most of the time we will be wait and watch, like how the what are the symptoms the patient is having, and how to correct, like that we'll be looking for. The main thing is the ideal thing, the fever. What you all know, we are giving paracetamol. It is a non-steroidal anti-inflammatory drug. With any infection, our body will produce like inflammatory mediators will release. So for the suppression of the interleukin, for a fever, interleukin 1 will be come into the picture. So for suppression of the fever, we will be giving the paracetamol. So this is an papaya leaf extract, what we are giving for platelet improvement. So some studies have shown that by giving this papaya leaf extract, there will be an improvement in platelet production. So we can try this tablet also. So main thing what the dengue patient will have is severe dehydration that will leads to the shock and death. So we have to mainly look for an electrolyte imbalance is there or not. Like if the patient is having severe electrolyte imbalance, they will be having severe dehydration. So it will leads to some other more complications. So main thing what we always do is to correct their electrolyte abnormalities. We will be rehydrating. This is an ORS. And IV fluids, I have already told, to correct the electrolyte abnormality. The main thing, the symptoms for the dengue patients, most of the time we will be managing with IV fluids only, because those patients will have electrolyte abnormality. So what we are using is ringer lactate and saline and DNS be used. The transfusion part, if the patient is having the severe and abnormal high PCV, we will be doing fresh frozen plasma transfusion. If the patient is having severe like thrombocytopenia, means very low platelet, our platelet count is 1.5 to 4 lakhs usually. It will, in the dengue patient, it will go even below 10,000. The patient will be coming with severe bleeding from all over the body. So immediately we have to do the platelet transfusion for collecting the platelets. If we do immediate and correct, if we will diagnose at the correct time, and we will be doing the correct treatment, we will be saving most of the patients. So prevention, you all know, anti-mosquito breeding measures, it should be followed, and it is a day-biting mosquito. So for the childrens who are wearing half trousers, should be encouraged to wear the full trousers. Like that, will be safe, mainly in the children. And also mosquito repellents can be used in the protection of children, I already told. So this is the vaccine which is not available in India. It is available in US. The dengue vaccine. It is given for 9 years to 16 years only, because only for those who got primary dengue fever, it should be used. Because if we use for like first time, if we use this vaccine, it will create a damage, vascular endothelial damage, and leads to shock and death and bleeding manifestation and so on. So it should be used only for the patient who already got infected with a dengue fever. So this is about the clinical manifestation and treatment part. Now Dr. Ashok will join and we'll be discussing about the any doubts.
So me and Dr. Fayaz will join now, and if you have any clarifications and any queries, like you can ask us. So like you are asking like what is an retroorbital pain and the pain behind the eyes, and so retroorbital pain, like these kind of patients, they have pain behind their eyes. So in particular, the retroorbital pain is seen in arboviral infection like the chikungunya and dengue. Like it's more common in cases like with chikungunya and dengue infection. So it's one of the symptom by which the patient can present to us. So that's going to be the retroorbital pain. That is the pain behind the eyes. The patient can also have arthralgia to the maximum extent.
Uh, Sir, can you give a clarification as to what arthralgia is?
So arthralgia, the patient is going to have pain of the joint. So in case of dengue infection, there is going to be the involvement of almost all the joint, but most of the patient, they are going to present with the complaint of pain involving the large joint like knee joint, hip joint, and ankle joint. So they are going to have pain of this particular joint. So that is going to be the arthralgia. So there is going to be a non-specific inflammation of the synovial membrane in this kind of patient. So ultimately, it is going to lead to the particular condition where the patient is going to experience a severe pain. So most of the patient, like they are going to experience severe pain involving the knee joint most of the time, and they can also have an associated symptom like retroorbital pain. So is there an biosensor for detection of dengue? So actually, like we do only the specific test. So we have the screening and specific test. So screening test, like we do the rapid, but the rapid is not sensitive and specific. There can be like a lot of time cross reaction can be happen, and it can give rise to the false positive reaction. So like most of the time, like we rely on the enzyme immunoassay. Like most of the time, we do like enzyme immunoassay like ELISA or CLEA, or even like we can go for other immunoassays like chemiluminescent microparticle immunoassay. Like it's quite sensitive and specific. And with most of the lab, like there is going to be the presence of the ELISA and CLEA. So most of the time, like with the presence of the control and the calibrator, like we are going to do the test and we are going to come to a conclusion. And we will be testing for the NS1 antigen, IgG and IgM. So as Dr. Fayaz said, like we will be like determining whether it's going to be a case of primary dengue fever or secondary dengue fever, depending upon the positivity towards NS1 or IgM or IgG.
You asked in secondary.
So why don't we have any vaccine for dengue in India? Okay, so most of the vaccine it's in the clinical trial. So in US, like they are going, in the particular vaccine, it's in the final clinical trial where they are going to use something called dengue vaccine. So it's going to be a live attenuated vaccine, which is going to be like preventive against the secondary dengue fever. So it is not for preventing the primary; it's only for preventing the secondary.
Good evening, sir. Hello.
Good evening.
Am I audible? Good evening,
Yeah,
sir.
you are.
Sir, I wanted to ask
Good.
where do you think we are facing the problem in trials for the dengue vaccine?
So like clinically, like we are going to face trial when it comes to the human trial. So like most of the time, like in case of arboviral infection, the problem which we are facing is going to be the cross reactivity. So the antibody which is going to get formed against this particular arboviral infection is not going to be like very protective. So we have learned during the time of arboviral infection, there is going to be the formation of two type of antibody. One is going to be the neutralizing and non-neutralizing. So which is like quite an unwanted one. So the neutralizing antibody is going to protect us, whereas the non-neutralizing antibody is going to be causing the damage to us. So like we are not having a very good vaccination, which is going to produce only the particular selective or protective antibody. And if you asked like what is the role of papaya leaf
Thank you,
extract?
sir.
Okay, so papaya leaf extract, like this particular extract contains a certain flavonoid compound which is going to protect the particular platelet. So it is going to have a platelet protective effect, and it's also going to improve the production of platelet from the bone marrow. So papaya leaf extract, like it will definitely it will promote the platelet production, but the side effect which we face with the papaya leaf extract is going to be the diarrhea. So most of the time, like we face patients like who are on papaya leaf extract, like they have irresistible diarrhea. Okay, so someone asked about the hemoglobin. So there is no variation in the hemoglobin. In case if the patient is going to have bleeding manifestation, again the hemoglobin can go down. So during the time of bleeding, the RBC is going to get reduced and the hemoglobin level is going to get reduced. Ultimately, the patient is going to go for anemia. So most of the time, like it's going to be in progressive, sudden onset anemia. So most of the time, it's going to be the iron deficiency anemia, which can be seen in this kind of bleeding associated anemia. And someone asked about the platelet count. Okay, so when we talk about the platelet count pertaining to the dengue, so during the time of dengue, like there is going to be fever, like it's going to be a biphasic fever. The patient is going to have fever for the first 3 or 4 days. After that, there will not be any fever for the next 2 or 3 days. Again, the patient will have fever for the from the 7th or 8th day. So that's going to be the biphasic fever. So what happens in dengue is that during that first 4 days, the platelet count mostly they don't reduce. It will be in the normal range. So normal range is going to be 1.5 to 4. So most of the time, like when it's going to be the day 1 to day 4, the platelet count is going to be in the normal range. But what happens is that on the day 4 or day 5, there's going to be the dip in the platelet count, and the patient is not going to have any fever. So during the day 5, 6, 7, like we denote it as a danger period where the platelet count can go down. So that is about the platelet change. So what we do is that like we are going to measure the platelet count each day. So when the particular platelet count is going to go down like less than 20 or 10, like we are going to do the transfusion. Like we can go for something like a platelet transfusion. So virulence factor of dengue fever. Okay, the most main virulence factor of this particular dengue virus is going to be the platelet damage. So it's going to cause damage to the platelet, and every cell has every virus has its own tropism. Example, in case if it is going to be HIV virus, like it will be acting against the CD4 cell. Like such that, like dengue virus is going to act against the platelet. So it's going to ultimately damage the platelet and destroy the platelet. And this particular condition is going to cause the hemorrhagic manifestation. It's going to produce thrombocytopenia, which is nothing but low platelet count, and the patient is going to go for hemorrhagic manifestation. Goat milk. Okay, someone asked about the goat milk, and in few recent studies, like a goat milk contains certain casein product which can improve the platelet protective effect and platelet production from the bone marrow. And again, like it's not tried clinically, but again, like in certain article, like it's given that the goat milk can serve as important nutrient which can improve the platelet production in case of dengue fever. But we doesn't know like if it is going to be a reliable one. So most of the time, like we rely on the papaya leaf extract, but not the goat milk. Okay, how to recover from the skin rashes. So what happens is that there is going to be the production of maculopapular or morbilliform rash during the dengue. So most of the time, like after the onset of dengue fever, like most of these particular rashes will disappear, and sometime the rashes can be there for some time. Most of the time, like we see rashes around the nose, mainly in case of chikungunya, which is called as chick sign, and the particular chick sign, like it will disappear after some 2 or 3 months time most of the time. So mostly like it is seen with the similar illness called the chikungunya, not dengue, which we call it as chick sign. So it is going to be a self-limiting one. Like after 2 or 3 months, like most of the time, like we will recover. The particular rashes will disappear. Can dengue cause brain death and hemorrhage in brain? Yes, it can cause hemorrhage in brain. And this particular thing, like I told, like it's going to cause thrombocytopenia. Mainly, like these particular complications are more common in secondary dengue. Like when we are going to get infected by the different serotype for the second time, there is going to be the particular damage caused by the non-neutralizing antibody. So at the particular time, it can lead to shock syndrome and thrombocytopenia. So both of this particular thing can lead to something called dengue shock syndrome. So was this session useful? Can anyone give feedback for the session today? And I really want to thank Dr. Fayaz. Like he's a very busy clinician, and he immediately accepted my request for joining today's session. And like I feel like he's the right person to handle today's session because like he's seeing like plenty of cases of dengue infection, and I think like his management, the way of management is going to be like very good. So I just called him for today's session, and without resisting, like he accepted. Like I want to thank Dr. Fayaz for today's session.
Thank you, sir. The main thing in the dengue viral infection, we should not get panic. it can be easily managed. Like it's in the simple in clinical setup, I'm managing so much of dengue cases. So it is very easy to handle. Don't get panic. So most of the time, patient will be good only.
So any more doubts? So any more doubts? Like you can ask us. Like we both are here to clarify the doubts.
Thank you so much for the time, sir. And so many doubts have really
Okay.
cleared with the help of this webinar on the
Sir,
dengue.
one more
Yeah,
doubt, sir.
thank you so much.
Yes, yes,
Sir, one more doubt.
yes.
Sir, it was transmitted from hereditary.
No, sir. It
Dengue
is
is
not transmitted
transmitted
hereditary.
from.
It is, no, sir. It
Yeah.
is not transmitted hereditary. Like it is transmitted only through the bite of infected mosquito. So hereditary, like there are certain disorders like which can get transmitted to hereditary, but most of the infectious disease they don't get transmitted to the hereditary mode. So most of the infection,
Okay,
like
sir.
they can be like due to the arthropod borne or fomite borne. So it's going to be an infective etiology which is transmitted by the arboviral route. That's why we call this particular infection as arboviral infection. That is arthropod borne viral infection. So we call it as arthropod. So those are the arthropods like insect like mosquito, so which is going to transmit the infection.
So dengue is mainly
Like,
mosquito-borne infection, which is transmitted through mosquito, and it is not. It will not transmit from mother to fetus or any other mode. So only thing if we get bite with the infected mosquito, like we'll be getting the infection.
So most of the time, like it will not cross the placenta. There is going to be the production of IgG, and the particular IgG will not allow the particular infection to pass on. So there are like other congenital infection which can pass through. Example, there can be like an congenital rubella syndrome or congenital varicella. So those are the virus that can cross the placenta and can harm the baby. So most of the time, like dengue will not harm the baby, but what can happen is that it can cause something like a hemorrhage. So intrauterine hemorrhage can happen in these kind of patients. So pregnancy, they are at high risk of bleeding manifestation. So there can be like bleeding complication which can arise at the time of pregnancy. If the patient is, if they are going for pregnancy, like if they are going for delivery, there's going to be a bleeding. And in case if they are going to suffer from dengue, like it can lead to huge amount of hemorrhage, and the patient can go for hemorrhagic complication. So dengue is Aedes aegypti. Okay, so this particular Aedes aegypti is a mosquito. So dengue mainly it's transmitted by two type of Aedes mosquito. One is going to be the Aedes aegypti and another is going to be the Aedes albopictus. So these are the two Aedes mosquito which we call it as tiger mosquito. So they are like dark mosquito with the white strip. We call it as a tiger mosquito. So this particular tiger mosquito, like once they are going to come and bite the infected individual, they are going to take the virus into them, and that particular virus is going to get propagated inside them. And this particular mosquito, when they are going to bite another human, they are going to transmit the virus from one human to another human.
in the human body, the virus has multiplication of was sexually or asexually infection, reproduction.
Yes. No, sir. Actually, like virus, like we don't have anything like sexual or asexual. In case if it is going to be like something like malaria, we have something called sexual and asexual reproduction which can take place. So it's going to be a virus. So virus, there is going to be only the replication. So in case if you are going to deal with parasite, like it has the definitive host and the intermediate host where the sexual and asexual cycle will happen. So that's about the parasite, not virus. So virus doesn't have any sexual or asexual. So it is only through the replication process.
So dengue virus genetical material was DNA or RNA, sir.
So dengue virus, it is going to be an RNA virus. So it is going to be an arthropod-borne viral infection. So it's going to be an RNA virus.
And it has contained to the spike or spikelets or
That
envelope
spike,
or
we
a
call it as a
non-envelope.
non-structural protein. So that spike is called as a non-structural protein. So like whenever like we are going to get infected, that particular spike is going to be get released in the blood. So that particular spike only we are detecting, which is called as non-structural protein, NS1
It
antigen,
must
which we
be
detect
contained in
usually in the
envelope
blood.
or non-envelope. It must be
Yes.
envelope or non-envelope, like that hemagglutinin, like that
So it's going to be a
any have a
non-enveloped virus.
spikelet
It's
direct.
going to be like
Oh,
it does not contain any envelope. So enveloped virus example could be something like an herpes. So most of the time, like enveloped virus, like
When
they
it
respond
has
critical to the
okay, when it has
yes.
not contained a hemoglobin neuraminidase.
No, sir.
Is it
Hemagglutinin
correct,
and
sir?
neuraminidase is seen only in the orthomyxovirus and the paramyxovirus. So there is something called influenza viruses, right? So I think you know about influenza. So it's caused by something called influenza virus and parainfluenza virus. So those contain like hemagglutinin and neuraminidase. HA and NA.
Ah,
So
yes,
depending upon that
sir.
HA and NA only, like we have that antigenic shift and antigenic drift. So each year there is going to be a pandemic and epidemic due to the strain variation, and there is going to be a variation in the H and the N, hemagglutinin and the neuraminidase protein.
But
It is seen in influenza
all
virus.
hepsovirus are contained in hemoglobin and neuraminidase, sir.
Yes.
Hepsovirus, all hepsovirus are contained
Hemagglutinin and
gluten and
neuraminidase. It is going
neuraminidase
to be
protein.
like, yeah, sir. It is going to be very
Contained
specific for
hepsovirus.
paramyxo and orthomyxovirus, like influenza virus, para-influenza virus. We have the mumps virus. We have the rubella virus. So they will be having that HA and NA spike, sir. It is not about the other virus. So mostly like this HA and
Hepsovirus also
neuraminidase has to
contained,
be yes.
yeah, hepsovirus also contained components, sir.
So like many of the viruses, they can contain the HA and NA, but HA and NA, like pathogenically, it's very important for the paramyxo and orthomyxo virus group like influenza. So here, like it is only about the damaging effects, sir. So on damaging effect and the tropism, like that is very important for this kind of viral infection.
Okay, okay.
All right. Thank you, Dr. Ashok and Dr. Fyaz, for giving your valuable time in speaking in today's webinar. I, on behalf
Okay,
of
we
the
have
whole SciBug
another
team,
study, I think. Okay, we have the how the particular spread by Aedes mosquito. Okay, like one like few of the viruses will be having the tropism towards the particular mosquito. In case like if you are going to study about the malaria, it is going to be the Anopheles mosquito. In case if it is going to be dengue virus, it's going to be like more specific for Aedes mosquito. This particular mosquito will not survive in this particular virus will not survive in other mosquitoes. So it's going to be like surviving only in the Aedes, mainly the Aedes aegypti and Aedes albopictus. And I wanted to thank the SciBug team for arranging this session. I think this particular dengue infection is more common in our part of the world. Like it is throughout the year, like this particular infection is there, and there's going to be an rise during the rainfall season. So that's why like we wanted to do on this session. I hope the session will be useful. As Dr. Fayaz said, like there is no need to panic, but like we need to protect ourselves from these kind of viral infection. It's very easy to protect ourselves. In case if we have an idea about this particular viral infection, we can protect ourselves and thereby we can avoid this particular infection.
Sir, one more question.
Yes.
Sir,
Yes.
sir, any Siddha medicinal related to this infection? Like Siddha.
No, sir. Actually, like we don't rely on Siddha medications. Sir. Like we, what we do is that like we can rely on like only the papaya leaf extract. So we can't rely on other Siddha medications. So papaya leaf extract we can rely. So it has a scientific proven background where we can use the carica papaya leaf extract, so which contains certain flavonoid material which can have an protective effect towards platelet. And most of the time, like there is no specific antiviral for this particular infection. So we go only for the paracetamol and the other measures for this particular infection.
Okay, sir.
So in the upcoming sessions, like we will see about some other tropical infection which is more prominent in our country. So if you guys have no doubt, like I think we can end up today's session. And I want to thank the SciBug team and Dr. Fayaz for once again for the session and arranging the session.
thank you, Dr. Ashok and Dr. Fyaz. I, on behalf of the whole SciBug team, really appreciate and thank you for today's session. And it was really encouraging and motivating for all of us to know more about the topics. Thank you so much.
Definitely, definitely, like we can do more session on many infectious diseases.
Yes, sir.